translating the answer.
Thank you so much, Dr. Das and Dr. Mahapatra. It was a wonderful talk, a very relevant one when in the earlier years of growing up. Now I would invite Dr. Arpit Parmar, who's the Assistant Professor in the Department of Psychiatry of AIIMS Bhubaneswar, who will be chairing a session on role of nutraceuticals in mental health, which will be delivered by Dr. Swapnajit Sahu. He's an Assistant Professor in the Department of Psychiatry, PGI Chandigarh. Over to you, Dr. Arpit.
Thank you, Dr. Shri. We have a session now on the role of nutraceuticals in the mental health. And to deliver this particular lecture, we have a very eminent rising psychiatrist from PGI Chandigarh, who is working there as an assistant professor for last around 1 year, and who is also kind of an alumni of AIIMS Bhubaneswar. He has worked here. So without taking your much time, may I request Dr. Swapnajit to deliver his talk. Over to you, Dr. Swapnajit. He's saying that he's unable to start his video and audio. Can you please check?
Yeah, thank you so much. Good afternoon, everybody. Thank you, Arpit. Thank you, Sri ma'am. And outside, I would like to thank the AIIMS administration, Bhubaneswar, and also Department of Psychiatry, which is of Bhubaneswar, which is very close to my heart. So it's just like a second home. So thank you for giving me this opportunity to discuss about the role of nutraceuticals in mental health, because so far we have heard about role in the child, role of them nutrition in the pregnancy in the females. So let's see how it can help in the mental health. Is there any role of the nutrition or nutraceuticals in the mental health also? So let me share my screen. Are the slides visible?
Yes.
Okay, thank you. So we know that so long as far as 400 BC, Hippocrates has said that let food be the medicine and medicine be the food. And also the ancient schools of medicines like Ayurveda and Chinese traditional medicine, they have also emphasized that healthy diet is a powerful tool for protecting one's health. And by health, they mean both physical and mental health. Nowadays, various dietary supplement, fortified food, functional food, nutraceuticals have been introduced, which have been now studied whether they have a specific role in the current medical practice. So what do we mean by nutraceutical? Nutraceutical means nutrition and pharmaceutical, which is derived from both words by Stephen in 1989. So by this definition, we mean that it is any kind of food which provides both medical or health benefits, including prevention or treatment of any disease condition. Also, it can be a product which is prepared from the foods but sold in the form of pills and or powder or in any medicinal form for the health benefits of the person. So in short, the mechanism of action of these nutraceuticals, now what are these nutraceuticals? I will be coming very shortly, but how it works. These nutraceuticals directly work at the cellular levels or in the intermediate pathway by modifying various growth factor, inflammatory mediators, protein kinase enzymes, transcriptor factors, so that by that they work at the genetics level and also on the proteosomes. So we know these nutraceuticals, they are nothing new for us. These are the polyunsaturated fatty acid, probiotics. Probiotics are nothing but live microorganisms which, when administered in adequate amount, they confer a beneficial effect on the host. Prebiotics are short chain polysaccharides which are commonly banana, tomato. Antioxidants are there a lot of vitamins, vitamin C, beta carotene, and glutathione, dietary fibers, and vitamins and minerals. So all these are known as the common nutraceuticals. Now let us see whether these have any role in promotion of mental health or prevention of mental health, or they have any role in the treatment of any mental health conditions. So probiotics, as you know, these are the commonly used food which we usually use before a dinner, like lassi, or nowadays it has been available in the packaged one, like the small Yakult. So these are also very, very beneficial, and this also comes under the broad rubric of nutraceuticals. So many times we are taking this, but we don't know what are the various health benefits of these products. So there are also, we also take various herbal nutraceuticals, like for the example, garlic, turmeric, ginger. So these have various anti-inflammatory properties, antiseptic properties. Ginger is known to is a stimulant. Hing or asafoetida is a stimulant or carminative. Onion has been found to have various antibiotic and anti-atherosclerosis effect. In short, specific to the mental health, there has been studies findings of the St. John's wort or the ginseng, which have various stimulation properties on the nervous system, and they have been used as antidepressant and also as antiviral. Now let us see how food affects the emotions. The food can affect the emotions in a bidirectional relationship. For example, mood can influence the food intake of a person, and on the other hand, consuming food can have influence on a person's mood and feeling. For example, when we are not expecting any food and we have our common food item in our plate, and we feel that this is very more delicious to the person, then it can be a pleasant surprise. But at the same time, if the same delicious food item or favorite food item is being prepared in a very bad manner, or it is not tasteful to the person, then it can arouse feelings of dissatisfaction and disappointment. Kaplan have also proposed that obese persons overeat when they're anxious, and eating reduces their anxiety. So there is a long link between food and emotions. Now this table shows that how each and every food item or nutrient what we eat, they have various impact on the mood. For example, complex carbohydrates, they produce a sense of calm. They lessen the high sugar craving and they decreases mood swing. This have been effectively used when we can see that when somebody is having mood swings or feeling low, then like complete intake of a complex carbohydrate, for example, bread, cereal, potatoes, they improve the sense of, it provide a sense of calm, and they improve the mood. Similarly, proteins have been found to boost the motivation, increase the alertness, sharpen the attention and memory. Omega-3 fatty acids, which have been adequately found in the fish and fish oil, they produce also sense of calm, and they reduces the sugar cravings, or the when somebody is having more craving for sugary drinks. So omega-3 fatty acid reduces that. Similarly, B complex multivitamins, they help in improving the memory, regulating the mood, controlling the emotion, and also improve the sleep. Vitamin D has been found very beneficial in the treatment of mood disorders. So in short, whatever things we eat, each and everything has an effect on the mood. Now, nutrition and mental health are related. From this diagram, we can see that if somebody is shifting to a specific society, which is very common, this is the nature of the human society to shift from one place to another, then it occurs a change in the typical dietary habits. And this also it can lead to food insecurity in that person. And over the long run, this had, because of the various enzymatic changes in the gut of the person, it has led to the genetics, the changes in the genetics. Later on, this play a role in the nutrition in the prenatal environment, in the conception period. And if there is a long-term poor nutrition during the early childhood days, it can lead to significant cortisol depletion, low energy and glucose metabolism, and also it impairs the antioxidant effects and also various neurotransmitter effects, which ultimately leads to poor mental health. Also, it has been said that eating is perhaps the ideal biopsychosocial behavior. Food provides the fuel which is needed for the brain to work, and the quality of fuel is determined by the nutritional value of that particular food which we eat. Diet is also important to psychiatry or mental health. Like diet has been an ingredient of important lifestyle changes, which often the cardiologist, endocrinologist, and gastroenterologist, they also often recommend to have modification in their diet for many improvement in the non-communicable disease. So most of the management of the non-communicable disease have a specific importance to the diet. Similarly, mental illness also require a preventive approach to reduce the disease burden. Now, nutrition and mental health, they have been related by the saying that various observational studies have found that the quality of the individual diets are related to the risk of common mental disorder. Some of the studies which have focused to see between the link between the nutritional status of the person and the mental health outcome, they have been found that those persons who have taking the Mediterranean types of diet or traditional diet, which have high proportion of nuts, legumes, fruits, and monounsaturated fatty acids, this society or this population have found to have lower rates of depression as compared to the those who is following other types of diet. Also, they have been seen that intervention in the form of dietary changes or supplementing specific nutrients, they help in decreasing the mental health disorders, and also it can have a preventing role, as well as they have been this certain dietary changes or specific nutrients, they have been found to have additional effect when used with the psychotropics. Now, we know that the gut and brain are also connected. We have an enteric nervous system, and also we have an central nervous system. So this gut and brain axis is known as the gut-brain axis, which are very well connected, which also affects the mood and emotions. So this is the gut-brain axis, which has a bidirectional communication between the central and the enteric nervous system. It links the emotional and cognitive centers of the brain with peripheral intestinal function, and also it helps in the organizing or stimulating the various neuroimmunoendocrine mediators, and this is the essential for regulating the various interaction between the food we eat and how our brain reacts to that. Now, coming to what are the various nutraceuticals or the nutrients which have been explored in the various psychiatric disorders and how they have been useful in mental health. Coming to the various vitamins. Vitamin D, which have been studied throughout, which have been studied in a large number of studies and meta-analysis, it has been found to be treating and preventing depression. Similarly, folate has been found in the useful in the treatment of depression and schizophrenia. B12 also in depression and schizophrenia. Vitamin E, there are various studies which have been found it to be beneficial in treatment of tardive dyskinesia. Vitamin C is an antioxidant which have been studied and found to be beneficial when supplemented in patients with schizophrenia, anxiety, and dementia. Similarly, the minerals like zinc has been found to treat depression or addictive beneficial effects in patients with depression. Selenium is also helpful in improving the memory and the working memory of the Alzheimer's patient. Similarly, antioxidant like N-acetylcysteine, we know that it has antioxidant and anti-inflammatory properties. It has been found to be useful in depression, bipolar disorder, and schizophrenia, particularly on the negative symptoms. There has been various RCTs which have proved that N-acetylcysteine helps in improvement of the negative symptoms. And also in OCD, it has been used as an adjunctive agent to the commonly used SSRIs or other drugs. Similarly, various herbs or phytochemicals like valerian root, which is a root commonly found in the Western African countries. It has been found to improve insomnia or anxiety. Passion flower, nowadays various soaps or various candles, they use this passion flower extract, which improves the sleep, or it helps in the maintenance of the sleep. So it helps in the treatment of the insomnia. Similarly, St. John's wort has been useful in treatment of disorder like depression and anxiety, and various studies have been found in this with regard to St. John's wort. Ginkgo biloba, as we know that it is helpful in improving the working memory and also the overall memory in case of mild Alzheimer's dementia patients or patients with mild cognitive impairment. Similarly, amino acid, if we see, then S-adenosylmethionine, it helps in the treatment of depression. tryptophan also in depression, because they have been seen to improve the serotonin intake capacity of the cells, and hence in turn they improve the depression. Then lysine, it has been useful in anxiety disorder. And also omega-3 fatty acid has been found to be useful as an adjunctive agent when used with psychotropics in schizophrenia and depression. Now, coming to neurodevelopmental disorders, are there any role in autism and ADHD? The answer is yes. Many studies and RCTs are there. If you search, there are also Cochrane reviews in the same, that in patients with autism, there have been found that they have low levels of magnesium, zinc, selenium, vitamin A, B complex, vitamin D, vitamin E, and omega-3 fatty acid in their blood, hair, and other tissues. This in turn, they suggest that the person with ASD in the children with ASD, they have deficiency of these major antioxidants and multivitamin and vitamins and various minerals. So there has been proposal to include these essential nutrients in their food or in their medication, so that they have a better output and their nutritional status should increase. Similarly, children with ADHD have been found to have lower level of omega-3 fatty acid, suggesting that there can be a role of omega-3 fatty acid in the improving the symptoms of ADHD. Similarly, in depression, and recent meta-analysis have found that of various 40 studies which have evaluated a long list of various nutraceuticals like folic acid, tryptophan, zinc, inositol. Various studies are there which have used whether additive effect of this nutraceutical helps in improving the depression. And from all the this meta-analysis found that of all the various nutraceuticals, there is positive beneficial effects of adding S-adenosine methionine, folic acid or folate, omega-3 fatty acid, and vitamin D in improving the depression outcome. Also, various studies have been found that is there any role of probiotics in depression? There are around 10 RCTs, and most frequently probiotics used were the lactobacillus, which is commonly found in the dahi or in the yogurt. So studies have found that out of 10 studies, studies have reviewed improvement in the mood symptoms when these probiotics are added in their day-to-day dietary patterns. Now, coming to psychosis, the main hypothesis that whether this nutraceutical have any role in psychosis or schizophrenia is the phospholipid hypothesis of schizophrenia, which means that the RBC membranes of the schizophrenic patients or patients with psychosis, they have low levels of essential polyunsaturated fatty acid, which postulates that abnormality in the phospholipid structures are leading to contribution of the symptoms. And for this reason, there have been various studies in which omega-3 fatty acid have been added to the antipsychotics. Now, various studies and meta-analysis have found that there may be some effective if we add to the antipsychotics, mainly of glycine, sarcosine, ginkgo biloba, and some herbs. But there is inconclusive evidence of omega-3 fatty acid, deanalyzed cycloserine. So there are various studies which have been upcoming day in and day out on the various Cochrane reviews also to see which are effective and which are not effective. But till date, these studies have conflicting evidence. When they have done with the measured number of studies, the sample size or the power of the studies are very less to suggest any recommendations. But in dementia, there have been studies with regard to ginseng or ginseng roots, which have been also found in various Ayurvedic preparation and herbal medicine, which have been found to improve the working memory. But the Cochrane review suggests that there is currently lack of convincing evidence to show that it has any cognitive enhancing effect. But in case of ginkgo biloba, there has been studies in the Cochrane reviews of around 36 included RCTs, and they have found that it appears to be safe with no excess side effects compared to placebo, and it helps in improving certain memory areas of the persons with dementia. Now, is there any role of managing of the metabolic syndrome? As we know, most of the patients with psychiatric disorders or those which have poor mental health, they often lead to metabolic syndrome. And also there is also other way relationship in which we know that metabolic syndrome also predisposes many of the persons to various psychiatric disorder, can be depression, anxiety, or there is also various association of the metabolic syndrome, strong association of metabolic syndrome with the psychotropics which have been prescribed for various psychiatric disorder. So nutraceuticals also play a role in management of the metabolic syndrome. For example, polyunsaturated fatty acid, berberine are the blueberries, psyllium or the other fibers are the dietary fibers or the isabgol husk, and cinnamon is dalchini, chromium, which is abundantly found in the sea fish. Banaba is one of the leaves and the roots which is commonly seen in the gardens. I don't know what is his Odia name or Hindi name. And bitter gourd, as we know, Karela. So these agents have been found to be effectiveness when introduced in the persons with metabolic syndrome. They aid in weight loss, decrease in the blood pressure, improve the dyslipidemia or improve the lipid profile of the patient, and also helps in insulin resistance. So various authors or researchers have proposed with the introduction of these food agents can help in improving the metabolic profile of the persons with metabolic syndrome. Similarly, when the focus is on women's mental health, so there are some studies which are focused to see whether there is addition of any customized diet or have any role on the mood of the women and men above 30 years. So they have given the same diet pattern to persons with both males and females above 30 years of age to see is there any relationship between the mood and the dietary pattern. So, and all are healthy males and females. So the main findings of the studies are that in both the gender, there have been significant general relationship between eating healthy food and following healthy dietary practices, exercises with the mental well-being. But however, more specific to the women is that when women follow unhealthy dietary patterns, the level of mental distress was higher as compared to the men, which means women are more susceptible to unhealthy eating than men. Also, there are studies which have found that those who are more engaged in eating fast food, skipping the breakfast, caffeine, and engaging in high glycemic food, they are associated with more mental distress in women as compared to the males. Fruits and dark green leafy vegetables are associated with improving the mental health well-being. And also the studies have found that if exercise has been introduced to those females who have been skipping the breakfast or using high glycemic food or engaging in fast food dietary pattern, then exercise significantly reduces the negative association of these foods with the mental distress. So these are some of the important findings when we see role of nutrition in women's mental health. So what are the take-home messages from my part of this talk is that pertaining to the nutrition and women's mental health is that if there is deficiency of omega-3 fatty acid status, it can increase the risk of depression more in females as compared to the males. Similarly, fish oil and folic acid supplements have been used to treat depression successfully, as evident from various RCTs. Folate deficiency reduces the response to antidepressant, which in turn signifies that suppose a female is not responding well to the antidepressant, then there is a need. Some studies have found that you need to go for checking the folate level of the person, and supplementing folic acid to the female with depression or treatment-resistant depression can help in improving the response to antidepressants. Similarly, deficiencies of folate, vitamin D, iron, zinc, and selenium has been more commonly found in depressed women than non-depressed women. More particularly, those with childbearing age are more vulnerable to the adverse effect of poor nutrition on mood. So, which means that if the nutrition status of the childbearing age woman is low, it can affect the mood of the female, and hence the pregnancy and lactation are the major nutritional stressor to the body. So, during pregnancy and lactation, if the nutritional status of the childbearing aged women are low, then it can have a significant effect on the mood. And the depletion of the nutrient reserve throughout the pregnancy and lack of recovery during the postpartum, it increases the woman's risk to depression in the later part of the life. Or it can also, it is a hypothesis that such poor nutrition during the pregnancy and in the postpartum period leads to postpartum depression. So I end my talk by saying that if we improve the dietary pattern of both males and females in general, then it can help in improving the both better mental health as well as the physical health, because both are interrelated to each other. Thank you all.
Thank you, Dr. Swapnajit, for this kind of comprehensive presentation about all the aspects of nutraceuticals and its role in mental health. It was a wonderful talk. So, do we have any questions? Questions for Dr. Swapnajit? Any questions from the audience?
There is a question in the chat box. From Dr. Jigyasa.
Okay.
So what she has told is, thank you, sir, for quite an interesting presentation. It does definitely highlight the role of nutraceuticals in mental health. However, because nutraceuticals are largely unregulated, how do we as scientific professionals take a balance?
Thank you for the question. Yes, the nutraceuticals which have been available in the market, we don't know their actual values to how much amount they are being regulated to the body if we take. In short, we need to derive the actual nutraceuticals values like omega-3 fatty acid from the traditional food which we are taking in our diet. Because whatever the medicines or preparations which are available in the markets, we don't know actual preparation to what degree of the milligram or what degree of the percentage they will be delivering to the body. So whenever we, as a scientific professional, we need to advise to addition of the vitamins, antioxidants, or amino acid from the normal day-to-day dietary food which they are taking in the in their food habits. And also we need to evaluate what specific food items they are missing for any specific nutraceutical. Like if they're missing omega-3 fatty acid by missing their fish, or missing their any item, or like liver oil, cod liver oil, then they can add such thing. In case of persons with vegetarian diet, there are various other options for including which increasing the omega-3 fatty acid in the form of PUFAs or in other oil like unsaturated extra virgin coconut oil. So there are many other options. So we need to evaluate what they are taking, so which can be supplemented in their normal dietary patterns. Thank you.
Thank you, Dr. Swapnajit.